Hi everyone, I'm Dr. Jenny Dhingra, a GP trainee with a specialist interest in sexual health, and today I'm going to talk to you about doing an out-of-programme experience during GP training. So what is an out-of-programme experience? Why should you do one? And how do you go about doing one? Well, I'll talk about this and a little bit about my experience doing one over the next few minutes. So an out-of-programme experience is basically what it says on the tin, and that's where you actually take time out of your training programme to enhance your clinical experience. This can allow you to gain more experience in an area that you're interested in or haven't been able to do during your clinical training. For me, this was a really exciting opportunity to be able to explore my interests, which are sexual health. But say if you wanted to do something else, such as a teaching fellowship, or perhaps work abroad, or perhaps do something in a specialty that you'd never really considered before, this would be a really good time to do it. It also kind of gave me a bit of a break from worrying about my GP portfolio, which is quite intense, and also worrying about the rest of my GP exams, such as the RCA, and just allowed me to kind of enjoy my clinical time a bit more. So I actually found applying for the out-of-programme experience not to be too difficult. I would say one of the most important things is to leave yourself enough time. I'd say about maybe 6 to 9 months, so you can kind of get all the paperwork and also allow yourself to give 3 months notice to the deanery. So for me to kind of get the ball rolling, I met with my clinical supervisor about 6 to 7 months before I started my clinical fellowship to kind of put forward the idea that I was interested in doing one. After having a chat, they basically gave me the green light to start applying for jobs and just said as long as I give the deanery the 3 months notice that they need, that it shouldn't be a problem. So basically, I then started applying for jobs. You do this by applying for basically any regular clinical fellowship job, which is something that you can do after F2. And this can be in any particular field that you're interested in. So for me, I used this opportunity to apply for a couple of sexual health jobs. You've got to remember though that you are applying for a clinical fellowship job, so you will have to interview for that job as well, and it's not necessarily guaranteed that you'll get it. However, if you are lucky enough to get it, you can then accept that job, negotiate your salary, and then basically put it on your application that this is what you're going to be doing for the next year. So that brings me to my next part. When is the best time to do an out-of-programme experience? So with GP training, there's a couple of places that you can do them. So you can either do it between GP ST1 and GP ST2, or you can do it between GP ST2 and GP ST3. Now, there can be advantages and disadvantages to both. Personally, I went for between GP ST2 and GP ST3. This allowed me to take my AKT, which is the Applied Knowledge Test, and luckily pass it before entering into that year. So that means that when I go back into my GP training in ST3, I will have already passed the AKT, so that's not something that I need to worry about. On the other hand, applying between GP ST1 and ST2 can take the pressure off taking the AKT and give you a bit more of a break and a bit more time to gain some kind of clinical knowledge in an area of your interest before you move into that kind of more intense exam stage of GP training. So like I said, there's kind of pros and cons to both sides here, but really it's a personal choice and to do with timing about when suits you best. For me, because I started my GP training kind of towards the midpoint of the pandemic, it kind of made sense for me to do it a bit later because there are a lot more clinical fellowship jobs available, especially within sexual health. So that was another reason for me wanting to do it. So why did I pick sexual health? Well, as I've said a lot in this video, I have a specialist interest in sexual health. So for me, I think sexual health is one of the most fascinating and interesting sectors of medicine. I think you get to meet some really, really interesting people. You get to study kind of diseases and STIs firsthand. And you get to really empower your patients to make informed decisions about their bodies as well. And, kind of take charge of their sexual health and have conversations with them around safer sex and pleasure and, just allow people to access knowledge that they may not have been able to in other areas of their life. As well, I do a lot of work in sexual health and sex education outside of my job. So doing a clinical fellowship in sexual health kind of allowed me to consolidate those two areas of my life together and allow me to kind of build upon them and allow them to enhance each other as well. I also think that sexual health is really relevant to general practice, mainly because you get to practice your kind of gynae examinations, your genital examinations, and get a lot better at dealing with things such as abdominal pain, UTIs, STIs, of which you'll see quite a lot in GP. As well, the contraception aspect of sexual health too is fundamental in GP, and you'll be seeing a lot of things like emergency contraception, contraception starters, pill starters, and kind of discussing all the different methods of contraception available to people as well. Another thing that I think is really fortunate within sexual health is that it's a really good opportunity to do your diploma from the Faculty of Sexual and Reproductive Health, otherwise known as the DFSRH. And sexual health and working in sexual health provides ample opportunities to be able to cross off some of the things that you need to get signed off. Things such as coil discussions, implant discussions, STI discussions, and also you'll be given a primary trainer as well, and you'll be able to kind of sit in on sessions with them and also sign off other areas of the diploma too. So that is another reason that doing a clinical fellowship in sexual health provides a lot of benefits, especially towards GP training. If you are someone who's already done the DFSRH, it's actually a really good opportunity to learn how to do things such as implants and coils as well, and get your letter of competency in that. And that's something that will definitely stand you in good stead for GP jobs as well later on. For me personally, I haven't done my DFSRH yet, so it's something that I'm actually working on at the moment, and it is so much easier being able to find the time to kind of do it, do the preparation, and do the things that are required for me. One other big factor was the fact that I was able to pick the location that I was working in. So for me, I'd always wanted to do a job in central London and work in a central London hospital. And I was really fortunate enough to be able to apply for one and get one based in East London. And this just allowed to work with a completely different demographic of people. I've been able to learn so many different things and work in areas that I never thought I'd be able to, and for that I'm really grateful. So that's just been a little bit of information about doing a out of program experience within GP training. For me personally, I think it's been a really rewarding experience. I'm really looking forward to kind of doing the rest of the year, exploring different areas within sexual health, getting my DFSRH signed off, and also actually taking some nice holidays, because like we say, if you've got a placement for 1 year, you can plan your holidays around that, which is an amazing feeling. So what I would say is, if you do have any interest in doing an out of program experience during your GP training, have a chat with your clinical supervisor early, and then kind of look into it and see where it takes you, because for me, it's been an overwhelmingly positive experience.
So today I'm going to be speaking to you about two different topics. First topic I'm going to be speaking to you about is tips on dealing with long night shifts and tips on dealing with burnout. Now,